Hi, and welcome to this audio file based on the co-created research proposal from the Suicide and Self-Harm in Young People research team as a part of the Youth Lives programme. Just to introduce you to this proposal was created by young people with lived experience of mental health, aged 14 to 21, and mental health researchers and clinicians through the Youth Lives project, which stands for Youth Lived Experience of Evidence Synthesis. Youth Lives was funded through the UKRI-funded Citizen Science Collaboration Award and ran from 2021 to 2024. The purpose of this proposal is to share the priorities and ideas of young people with the research community, with the hope that these ideas are taken forward and youth voices embedded in future mental health research. Please feel free to use the ideas presented here to support future research bids. We would just ask that you let the Youth Lives team know and acknowledge the Youth Lives project in any bids and papers published. Additionally, we would strongly recommend the use of participatory approaches with young people in future research inspired by these proposals, and we can share details of your project with the young people involved in Youth Lives if you are interested in working with them. You can get in touch with the Youth Lives team by emailing youthlives-project@york.ac.uk. Now, I have the Suicide and Self-Harm research team with me here, and they're going to talk through their research proposal based on how do interventions for at-risk young people affect their coping skills and help-seeking behaviour. So first of all, please could you explain the background and significance of your research?
Well, young people often face unique physiological and social challenges that influence their coping strategies and willingness to seek help. However, existing interventions don't always account for these nuanced experiences. And this leads to a one-size-fits-all approach that isn't always effective for everyone. This gap highlights the need for research that explores how tailored interventions can better support the diverse coping styles and help-seeking behaviours among young people at risk of self-harm and suicide. Regarding the gap in research knowledge, studies that examine the broader behavioural and psychological impacts of these interventions over time are definitely needed. This gap in knowledge is significant because understanding these long-term effects is crucial for developing comprehensive intervention strategies that not only address immediate risks, but also promote sustained mental health and well-being. From the perspective of young people with lived experience of mental health, it seems that many aren't actually aware of the interventions in place for young people, or why so many young people seem to be experiencing these suicidal thoughts of self-harm, let alone anyone really being curious of the effects of these interventions. Additionally, the interventions used to help young people who self-harm and experience suicidal thoughts frequently is not a widely discussed topic in research, especially in terms of how beneficial they are, or whether they just become temporary solutions, not really sorting out any issues. Priority for young people with lived experience of mental health are a greater variety of different ways of helping young people suffering from self-harm or suicide, including different strategies in place so all people feel included with more coping styles in place. Also, to create more awareness so more people suffering can reach out to support services and feel like they are catered towards their specific needs. Awareness of support programs as well for young people facing these thoughts is limited, and many don't fully understand why these struggles arise. This highlights a broader challenge in grasping mental health issues and how interventions can really make a difference.
That's brilliant, thank you. And could you explain what the vision for this work is?
Young people at risk of suicide and self-harm represent a vulnerable population facing significant mental health challenges. So this research explored the effectiveness of interventions specifically aimed at improving coping style and promoting health-seeking behavior among this group. So our study focused on young people aged 12 to 25 years, including teenagers, and young adults. Using a price approach, we began with surveys and story competitions tasks to identify what intervention young people use and find effective, followed by the co-designs of an intervention with young co-researchers, mental health practitioners, and community members. The co-designs intervention will then be evaluated through a random controlled trial, which is called RCT, to assess its impact. By centering the voice and experience of young people, this research aims to generate meaningful insights to inform mental health policies and practice.
Thank you. Would you be able to speak about the literature and knowledge already known in this area?
So we've conducted a wrapping scoping review to explore the extent of literature on the effects of interventions for young people at risk of suicide and self-harm, with specific references to their coping styles and help-seeking behaviours as outcomes. Due to the large amount of studies in this area, we limited our review to systematic reviews and found 1,940 potentially relevant records, which were reduced by title and abstract, followed text screening to 206 relevant studies. The results were coded and placed into an evidence gap map, plotting the study focus against the outcomes. There were some clear patterns in the literature. Most reviews looked at the effectiveness and treatment of psychological or educational interventions. There was little evidence of variety in types of treatment outside of these. Most reviews were relatively large, suggesting a substantial amount of primary research in the area. Arguably most importantly, reviews primarily looked at effectiveness of outcomes on depression, suicide rate, suicide ideation, presence of self-harm, and very few looked at the views of experiences of those involved or coping styles. From the knowledge and experience of young people with lived experience of mental health, the studies that were informed of those that emphasize the success of cognitive behavioral therapy in boosting coping skills and lowering anxiety and depression in young people, as well as research on digital mental health tools that show promise in promoting help-seeking behaviours and providing early support, which can really help people out. Innovative approaches like mobile phone apps and peer support platforms are also gaining attention for their ability to reach young people in accessible and engaging ways, making mental health care much more inclusive and effective.
And now, could you talk me through your proposed method for this research?
The proposed methods for this research have been co-written by UKRI Research and Mental Health Research. These have been supported into work packages as follows. Work package 1 are surveys and story completion tasks. Work package 2 is the co-design of an intervention, and work package 3 is the random controlled test of the intervention.
Work package 1 aims to understand what interventions young people at risk of suicide use and are effective through longitudinal surveys and story completion tasks. Story completion tasks will be given to people aged 12 to 25 years old. This includes adolescents and young adults who are at critical developmental stages and are likely to face significant mental health challenges. This age range will be divided into 3 age ranges: pre-teenagers, 12 to 14, teenagers, 15 to 19, and young adults, 20 to 25. Story prompts will be different for the age ranges, but will ask about the ways characters in the stories cope and ask for help in different situations. Prompts can include scenarios where characters face mental health challenges, such as coping with school stress or evaluating effectiveness of therapy. Through narrative analysis of the result, this activity will give information on reactions to interventions and types of interventions, which can inform the design of the longitudinal survey. The participants who take part in the story completion task will then be invited to take part in the longitudinal survey and will ask about help-seeking behaviours and other interventions. Interventions may include cognitive behaviour therapy, group therapy, peer support programs, online mental health resources, and crisis intervention services. Since these interventions are commonly used and have varying levels of evidence supporting their effectiveness, the survey will use standardized scales and questionnaires to measure coping styles, psychological well-being, and propensity to seek help, e.g. a COPE scale. The longitudinal survey will run for 2 years, completely online and prompted for completion monthly, with an additional questionnaire sent weekly to inform a diary responses. Financial compensation of a £20 gift voucher will be provided for completion of the survey each month. From these methods, we will gather insight into the effectiveness of popular interventions, risk factors, protective factors, contextual factors, and preferred intervention delivery, methods and approaches which will be used to inform Work Package 2.
In Work Package 2, small groups of young people at risk of suicide and self-harm, mental health practitioners, Educators and representatives from NHS groups and other relevant community organisations will be brought together to discuss coping strategies and to design an intervention. Initial findings from the survey, as well as a literature review, will be shared with the groups. Groups will meet every 2 weeks for the first 2 months, and monthly for a further 6 months with an online page for sharing ideas in between. Participants would receive a £20 Amazon voucher for each meeting attended. The TADIA framework will be used to co-design the intervention, and decisions will be made as a group as to the content of the intervention, who delivers it, the frequency, and the intensity. Through this process, we will learn what a best practice co-design intervention looks like, who is likely to benefit from it, expected outcomes of the intervention, what resources will be required, and learnings from the process of co-design itself.
A work package 3 is random controlled testing. The co-designed intervention will be tested through a random controlled test, accompanied by a process of evaluation. The RCT, random controlled test, would last 12 months to allow for sufficient data collection to observe the intervention's short-term and potential long-term effect, thus providing comprehensive insight into the effectiveness. Participants will be recruited through schools, mental health organisations, and NHS groups. Outreach can include informational sessions, flyers, online advertisements, and collaborations with community organisations. Participants can be randomly assigned to either the intervention group or the control group, using computer-generated random numbers to ensure unbiased allocation. The control group will receive standard care, which may include existing mental health services and resources, but not the co-designed intervention. The intervention can be delivered through a combination of in-person sessions and online resources, facilitated by trained mental health professionals and peer supporters. For any in-person sessions, free travel and refreshments will be provided. The standardised remuneration fee will be given to participants.
And how are you hoping to evaluate this work?
We aim to develop an effective intervention to improve coping styles and increase help-seeking behaviour among young people at risk of suicide and self-harm. We will measure these outcomes using validated scales and RCT results, and we hope to influence mental health policies and practices. With these findings, we will work with policymakers to effect change and to encourage further research into interventions.
How will you communicate those findings?
Findings will be disseminated through academic publications, conferences, and community engagement, so that we can reach diverse stakeholders and maximise the impact of the research. Additionally, we will take findings to stalls/booths at local mental health festivals to share knowledge, which will also be posted on the website and potentially through a podcast. In addition, information will be distributed through the organisations involved and through an assembly detailing what has come from the research, as well as leaflets and posters placed around in public spaces where they will be more accessible to young people. For inclusivity and accessibility, public output will also include a dyslexia event-friendly version, yellow backgrounds in different fonts, translated versions, audio versions, ideally with different accents from different regions, subtitles, visual aids, and trigger warnings.
And can you talk me through the ethical considerations that you took into account when thinking about this research?
For all activities, we will seek university ethics approval and NHS approval where required. Overall, we will approach participants with respect and sensitivity and acknowledge their lived experiences and ensure their voices are heard. We will also ensure participants feel empowered and valued in the co-design process. For safeguarding, younger and older participants will be kept in separate groups, and participants will be permitted to leave at any time or can take breaks. Participants will also have options of providing information through written or verbal formats. Additionally, before any personal stories are shared, the group will conduct a well-being check to ensure they're okay. Alongside maintaining confidentiality and creating a safe space for open discussion, we will also focus on building lasting relationships. By keeping participants involved in future efforts, we create a sense of ongoing collaboration. Additionally, being culturally aware and responsive helps us address the diverse backgrounds and needs of everyone involved. Finally, we will inform participants on what data we are using, ask them if they understand why and what they are being used for in the investigation, and throughout the process, keep participants informed by sending emails detailing how sharing their experiences is helping the investigation and overall. In terms of data, we will adhere to GDPR and ensure all data collected is anonymized to protect participant identities. emphasize that participation is voluntary and participants can withdraw at any time without consequences, and handle sensitive topics with care, providing support resources for participants if needed. For the RCT, we will ensure that the control group receives standard care to avoid withholding necessary support, monitor participants closely and provide immediate support if any adverse effects are observed, and clearly explain the purpose, procedures, and potential risks of the RCT to participants so they fully understand their involvement.
And what risks do you see with this project and how would you mitigate them?
So one risk is that the content could be quite triggering. The mitigation is proactive management and signposting to relevant support systems. Another is power dynamics and co-design. Time is being taken to build relationships and co-create a charter of working. Another risk is participants/researchers leaving halfway through. The mitigation is recruitment will continue throughout the process through community partners. Another risk is any interactions with minors can be more dangerous and need to be carefully controlled. So to mitigate this, in all interactions, we have a safeguarding team member present, and researchers will have a safeguarding and DBS checks. The final risk is that people feel distant, cold, or unwilling to contribute or share. But to mitigate this, we're going to build rapport by frequent one-on-one check-ins.
Thank you. So to speak about the team that have put this together, this team consists of Youth Lives participants, which are 8 youth co-researchers aged 15 to 23 years old at the start of the project in 2022, from a diverse range of backgrounds and demographics. Additionally, 4 mental health researchers worked with youth co-researchers to co-produce this work, and 5 members of the core Youth Lives team who have experience across citizen science, mental health, and knowledge mobilization facilitated this process. Youth co-researchers have a specific experience of counselling through CAMS, school counselling, ASD diagnosis through CAMS, mental health conditions and family members, involvement in mental health charities and projects such as the Mental Health Foundation, SEND Project, and SEND Charity, and experiences in school and counselling that gave more experience in these topics. Finally, I'd just like to remind you that please feel free to use these ideas to support research bids. We really want to make sure that we are embedding these priorities of young people into future mental health research. If you do use any of these in any bids or any papers, please do acknowledge the Youth Lives team. Additionally, we would strongly recommend the use of participatory approaches with young people in future research inspired by these proposals. If you're interested in potentially including some of our young people in your work, please email us at Youth Lives and we will share the details of your project with those young people and ask them to get in touch with you if they are interested in being involved. You can get in touch with the Youth Lives team by emailing youthlives-project@york.ac.uk or by visiting our website at www.site.google.com/york.ac.uk/youthlives/home. Thank you so much for listening and do get in touch if you have any questions.